what an intro. Thank you. In my head, I'm a practitioner because that's how I started, you know, frontline work, supporting victims of domestic abuse and sexual violence. And everything has come from that. But for me, as I go forward to do more research, whilst I absolutely love research, which is really geeky, I never want to forget that actually it's all about practice. It must always be about practice, because otherwise it's just research and it doesn't make a difference to women, to men, to children on the ground living with domestic abuse day in, day out, and people that are trying to support them and trying to save their lives ultimately. So I'm going to share really some context around the issue and to think a little bit more about what we know, both in terms of prevalence and victim profiles. So we've learned a little bit already. And I'm going to end with some recommendations that I hope will support the aims of today about really creating hope through action. And I'll start by saying I always want us to be bold. Let's not do what's already been done because it's not working. So we need to be bold, and we've got to be really aspirational, even though it's really hard and there's no resource. So we're going to have to be creative and innovative. So I'm going to give you quite a lot of stats, and I'm sorry that I'm going to throw them at you, but I think it's important to understand the context. So in 2004, Sylvia Walby extrapolated from wider data sources and suggested that more than 1/3 of all female suicide in England and Wales may have been caused being subjected to domestic abuse. Now, obviously, 2004, it's a long time ago. When I last spoke to Sylvia at the height of COVID, she felt those figures really held. So I don't think there's been a huge amount of movement there. Now, Southall Black Sisters in 2011 did some work, and they documented that across a sample of over 400 domestically abused women that they were working with, some 44% had contemplated suicide, and a further 18% had made an attempt to do so. And during the 8-year period of the study, 8 women had gone on to take their own lives. Moving to 2018, Aitken and Munro conducted a study of 3,500 cases from the refuge client base. They found that nearly 19% had reported feeling suicidal currently or recently, and just over 18% had confirmed having made plans to end their own lives, with 3% saying that they'd made at least one failed attempt to do so. We've talked about real-time surveillance in your area, but actually Kent have done a lot of work on this, and their data says that approximately 30% of all suspected suicides in the Kent and Medway area between January 19 and January 2022 have been impacted by domestic abuse. And again, like here, that includes perpetrators, victims, and children. Recognising children are, of course, victims, but the classification is helpful for them in terms of their interventions. So, as we've seen today, you've got a 22% figure in Merseyside. So, you know, we're sort of in the same ballpark, aren't we? And I was at an event yesterday in Portsmouth, and they're reporting 22% as well from their 19 months of real-time surveillance data. So we're starting to see a bit of a pattern. We need to think about men, because we know that suicide is gendered. And that's sometimes difficult for us in the domestic abuse sector, because clearly domestic abuse is gendered and we do so much work with women, but we know suicide is also gendered. So NCISH, the National Confidential Inquiry into Suicide and Safety and Mental Health that Louis is a part of, in 2021 they did a study and they looked at suicide in middle-aged men. They found that 7% of suicides, those men reported having been a victim of domestic abuse, and for 5 of those that had been a really recent victimisation. So I'm going to move us forward to 2022. There was a Home Office-funded domestic homicide project. They were the first that really started counting suicides within the domestic homicide umbrella, although DHRs have been doing it, and the AFTER team have been doing it as well for many years. They found there were 114 victim suicides following domestic abuse in England and Wales in the 24 months from the 1st of April 2020 to 31st of March 2022. Again, as Ruth spoke to earlier, that's police-reported data, so it likely underestimates the problem. I think one of the speakers referred to the Lancet, I think it was Jeanie, the Lancet report that said that amongst people who'd attempted suicide in the past year, nearly 50% had ever experienced intimate partner violence, so in their lifetime. Half is a massive number, and just over 23% had experienced intimate partner violence in the last year. bear in mind, that's only intimate partner. So that doesn't include child-to-parent violence, where you have adult child-to-parent violence, so none of the other sort of things that we might consider as being domestic abuse more widely. So the government in their domestic abuse plan has expressed concern about the effect of domestic abuse on suicide. They've noted that in too many cases, harms inflicted by domestic abuse perpetrators can result in a victim taking their own life. So moving on to think about perpetrators of abuse, it's really important for us, if we're thinking about suicide prevention, to think about everyone. And I know, again, coming from a practitioner background, it can be really difficult. And I've just come from a role of, I was CEO of a charity where we supported perpetrators of abuse with behaviour change. And it is a real mind shift. But ultimately, one of my team said to me, you can't just be trauma-informed for the people you like. You know, and that's so true, isn't it, of being trauma-informed and about suicide prevention. We want to save all lives. And there is so much trauma in this group. So a recent report that was published from the University of Bristol using routine anonymised data from the DRIVE project, and the DRIVE project, for those of you that don't know, and sorry if I'm teaching you to suck eggs, supports and challenges perpetrators of domestic abuse to reduce harmful behaviours. And that's really significantly extended what we know about perpetrators. So there are around 400,000 high to medium risk domestic abuse perpetrators in the UK. Only 1% of those are in contact with specialist support services. Of those in touch with services, it's estimated 62% have significant mental ill health, and 21% have planned or attempted suicide, so a fifth. So just a reminder on the last slide, when we were talking about victims in that refuge report, we found that 18% had confirmed having made plans to end their own lives, and 3% said that they'd made at least one failed attempt. So oddly, also 21%. So going back to the Bristol work, there were 10 deaths by suicide that were recorded in the DRIVE case management population during what they call the follow-up period. And this covered the time from March 16 to April 22. This is where it gets really interesting, if you're not interested by the data in and of itself, but of the population of high-risk, high-harm perpetrators who were in touch with services, the report estimates an annual suicide rate of 461 per 100,000. Doesn't sound a huge amount, but this is when it gets really interesting. That's my geek coming out. You may want to note that the suicide rate in males in England and Wales is 16 per 100,000. With the highest suicide rate being in males aged 45 to 64, and that's at 20 per 100,000. So the rate in high-risk, high-harm perpetrators of domestic abuse is 23 times greater than the highest age-specific suicide rate in the general population. That's enormous. So whilst the evidence base of what we know about victims, about perpetrators is growing around prevalence, in truth, we just don't know. We don't know how many women, men, children, we're going to be started on children, no one's even started counting children, really, in any meaningful way, who are taking their own lives as a result of domestic abuse. Individuals aren't being counted, and they are perhaps the most invisible victims of domestic abuse. Although, I'm going to take you through some more slides, and actually they're not invisible at all. So I know we've got a mixed audience with a range of experience, so if you're really familiar with domestic homicide reviews, I apologise, but I wanted to make sure we were all sort of starting from the same point. So in England and Wales, statutory reviews into domestic homicide, known as domestic homicide reviews or DHRs, they were implemented in 2011, thanks to Frank Mullane, and distinct from a criminal justice investigation, which obviously focuses on the attribution of responsibility, DHRs are really an exploration of the broad circumstances in which the death occurred, with a view to learning lessons that can improve our safeguarding, agency responses and learning, and support provision. Home Office guidance says we should illuminate the past to make the future safer. Reviews need to be undertaken with a commitment to professional curiosity, both in understanding the dynamics and effects of domestic abuse from the perspective of those impacted, and in critical reflection on agencies' involvement and interventions. So initially, these reviews were only commissioned in cases of domestic homicide. But in December 2016, the statutory guidance was extended and includes cases of suicides where the circumstances give rise to concern. Now, that's quite a tricky statement in and of itself, but that's what it currently says. So this means that we should be commissioning domestic homicide reviews where domestic abuse is an antecedent in cases of suicide. However, despite this requirement, there's a limited number of reviews that have in fact been commissioned, and many cases simply go uncounted. So in a second, I'm going to take you through what we learned from DHRs and the research that I was able to undertake with some colleagues. But again, I wanted to offer a bit of scale here. So there was a recent FOI to the Home Office from Louise Tickle. She's a journalist with Tortoise Media, and she did a podcast on actually the Kelly Sutton case. In 2020, the Home Office received 130 DHR notifications. So that's notifications from community safety partnerships of their intention to commission a domestic homicide review. So of those 130, 24 related to suicide. So that represented about 18.5% of all notifications. That number fell in 2021 to just 14.5% of DHRs. In 2022, it rose again, so with 23% of the 192 DHR notifications relating to deaths by suspected suicide. And really interestingly, between January and July this year, so really bang up to date, the Home Office received 36 notifications relating to suicide, and that was 28% of all of their recommendations. Interestingly, though, that reflects a lower than this area. I was with Portsmouth, as I said, with Portsmouth yesterday, it's lower than their area. I know it's lower than Plymouth, which is sort of my local area. So the number's growing. We know the number's growing. And as I said, we know in other areas it's actually much higher than what the numbers that we're getting out of the Home Office at the moment. But essentially what we know from that Home Office data, that hard data, is that reviews into these deaths now represent at least a quarter of all DHRs that are being conducted. And that really should give us all the impetus to be focusing more closely on the links between domestic abuse and suicide. So last year, I was able to undertake some research with Professor Vanessa Monroe and Lotte Young-Andrade of the University of Warwick on behalf of AFTA. And I want to share a little bit about that. Before I start, though, because I'm going to talk about data, I just want to really say that we need to pause and remember that when I'm talking about the 32 DHRs in the sample and thinking about and talking about it as data, these are human legacies. These are individuals who have left behind children and families and friends and communities that desperately loved them and missed them, and who had to watch as they experienced this domestic abuse. And a DHR really, it can feel sometimes quite clinical, and when we talk about them it can feel clinical, but actually they are lasting legacies of someone's experiences and their experience with our systems, and I just think it's really important that we acknowledge that before we start to sort of look at what we learn. So, as I said, we looked at 32 published domestic homicide reviews. It doesn't seem like a massive number, but it was everything we knew and could find that had been published at the time, and we believe we captured nearly everything that had been published. We also did 36 semi-structured interviews with professionals, with DA leads, suicide prevention leads, DHR chairs, and critically families. We had a family stakeholder group, we had an academic steering group too, and we also did a family focus group. So what we wanted to understand was their experiences, profiles of individuals dying by suicide, and also some learning from what happened after their death. So today of those, I'm really going to focus on party profiles and agency involvement before we start thinking about what we need to do next. So unsurprisingly, for those of us working in domestic abuse sector, the majority of victims were female and the majority of perpetrators male, most commonly partners, ex-partners or husbands. Ethnicity data was really tricky because it was missing in 20% of the reviews that were published, which is, you know, there's our first problem, isn't it? Just the data just not being there at all. So where it was noted, the majority of victims were classified as white British, but we know that we have this just enormous knowledge gap in terms of minority communities, and that's a gap we desperately need to fill if we're to understand the issue. But almost 2/3 had dependent children, half of whom were living with them at the time of their death. In 12 of the reviews, there were concerns and significant concerns about custody of their children. In 90% of cases, there was a history of mental health issues, and in almost half of cases, evidence of a history of self-harm. In almost 2/3 of the cases, there was an evidence of previous suicidal ideation. 2/3, that's some really significant opportunity to intervene. Almost half of victims have prior experience of abuse as an adult. Housing and or financial precarity was apparent in 65% of cases, and there was evidence that the victim had difficulties with drug and alcohol misuse in half of the DHRs. Often looked at with a very narrow lens. You know, she drinks a lot, she's a drug user, and then what that then means for her interactions with services. Actually, she's managing trauma, is what she's doing. But yeah, we saw some very siloed responses. So although domestic abuse remains significantly underreported overall, within our sample there was often really, really clear evidence of victims navigating complex needs in plain sight of statutory agencies. These primarily women were not invisible at all to services. Just over half of the victims had engaged with specialist domestic abuse services. 2/3 had engaged with mental health or counselling support. 3/4 were known to have regular contact with their GPs, and it goes back to what Lewis was saying about, you know, that health response. 90% had a history of police contact, and 30% had access to specialist addiction services. Really significant contact with services. Across all of these interactions, what we identified is a lack of professional curiosity to ask questions about domestic abuse, about suicidality, and indeed the connection between those two things. There was also evidence of really inadequate risk assessment training and tools. I think we all have our views on the DASH, but, you know, and how fit for purpose it is when we're thinking about suicide risk. And to really appropriately identify risks of self-harm and suicidality, and a real tendency, as I said, towards those siloed responses. And we saw in some reviews just a real lack of empathy and compassion for the complex needs that victims were navigating, and some barriers, therefore, to their help seeking. I wanted to give an example. So in DHR 16, the victim had lost 5 stone in weight in a 2-month period after she married her perpetrator. The GP, with whom she was in regular contact, was aware of her abuse in her previous marriage, as well as in her current relationship. He'd noted there'd been recent called outs from police, from victim support, and he said that she appeared to be in acute distress during the consultation. Despite that, rather than probing further, he noted she was a large lady, and so her dramatic weight loss was to be welcomed. In terms of chronologies immediately prior to death, in many of the DHRs, the suicide reflected this end point of being gradually ground down and isolated, both by the domestic abuse, but importantly, by the failures of the systems and professionals to help them. And at the same time, there were several cases where there was an acute stressor in the period before the death. So, for example, around criminal justice or social services, so removal of children, or being told that the perpetrator was on bail when in fact he wasn't. So there's kind of acute stressors. And I wanted to share another example. In another of the DHRs, the victim called 111. She reported that she was having suicidal thoughts, and she'd made 2 prior attempts to take her own life in the preceding weeks. A clinical advisor had to contact the crisis team and was told that the victim wasn't currently on their caseload and would need to be referred back to her GP. So she went back to the victim to explain the system and the process. And in response, the victim said that she got that a lot and said, "I'm not phoning anyone else. Everyone turns me away. What's the point?" And she took her own life a few hours later. Notably, bearing in mind our focus today, improvements to and better engagement with suicide prevention strategies accounted for less than 3% of all recommendations in DHRs. Essentially, we're reviewing a death by suicide and we're not considering suicide prevention. And we need to extend our thinking in these reviews beyond domestic abuse and the domestic abuse lens. So you'll be glad, my last slide. So finally, it's sort of my call to action. You know, what can we do? We need to consider domestic abuse, as Lewis said, and as you're doing here, in local and national suicide prevention strategies. We know there's lots of areas like yourself who are considering domestic abuse, and this event is happening because you all recognise how important this is, and like you said, you're leading this work nationally. We know that when the national suicide prevention strategy is eventually delivered, domestic abuse will, for the first time, feature. And I really look forward to, and I'm sure you do too, to seeing how far that might take us and what that might enable us to do. And hopefully some funding. That would be really welcome. For those of you working in suicide prevention, build links and partnerships with your domestic abuse colleagues. And for those of you in the DA sector, talk to your suicide prevention colleagues and let's explore together and consider our opportunities for risk assessment. Like I said, the dash in the domestic abuse world just does not do enough around this issue, so we need to come up with something better. We need to try something better. Again, if you're working in suicide prevention, please engage with domestic homicide review processes where possible. They're a brutal process to be part of, and they take something from you, but it's so critical. These reviews need your expertise, and they need to be translated into recommendations and actions. And again, Louis touched on it, we need to talk to individuals who have self-harmed. We need to be professional curious with those individuals and better understand. We need further research and data, locally, nationally, internationally. So how do we bring the real-time surveillance data around the country together to better understand the scale and prevalence? Because at the moment it's pockets, and the pockets are telling us similar things, which is interesting in and of itself. Portsmouth is very different to Merseyside, but we need to bring that data together. We need to learn more from the DHRs. There's more of them now into cases of suicide when they're published, and we need to use all of our experience and all of our expertise and innovation to come together and design interventions to address this issue. We might fail, but we keep trying until we find something that helps. And once we do that, we need training and improved practice in relation to suicide risk that really includes preventative and protective interventions so that we can reduce the number of deaths by suicide in the context of domestic abuse. Thank you all.